Good afternoon, everybody. Kia ora and whakalawhalahi atu. Warm Pacific greetings to you all. My name is Okesene-Gafa. Oh, sorry. I didn't realize that I was supposed to hold that. And I'm one of the obstetricians here at Middlemore Hospital. I'm also senior lecturer at Department of ONG. And I'm also a PhD student, so this is part of my PhD. So thank you very much for the previous speakers because they've gone through some of my background, so I don't have to go through it so much. As you can see there, like the other speakers have covered, that we have very high rates of obesity in pregnancy in our women, especially Pacifica and Maori, who enter pregnancy with a high BMI. And you already know we have most of our women live in the highest deprivation centile, and we cover the huge area around South Auckland. Like the previous speakers, obesity and then also excessive gestational weight gain increase those complications. So I'm focusing mostly on excessive gestational weight gain. But obesity itself, actually almost all the complications we have in obstetrics is due to obesity as well. And long-term obesity in offspring and the mother. Now, and this is a real worry, and that's what drove us to think about, how can we break this intergenerational cycle with a mum with a really high BMI who then gains excessive gestational weight gain, which is a modifier risk factor, so that we can sort of break this intergenerational cycle with excess nutrition to the fetus, and then childhood obesity, adult obesity, and then the cycle continues. There was this meta-analysis in 2012 that looked at maternal weight obstetric outcomes and interventions that might be effective. So I'm just going to focus specifically on dietary interventions because it reduced gestational diabetes, hypertension, preeclampsia, excessive weight gain in the mum, preterm births, and shoulder dystocia in the infant. And what was also evidence that came out at that time was probiotics and dietary interventions actually reduced gestational diabetes by about 60%. So we thought, and the probiotics that they used in that trial is the same ones that we used in the HUMBA, which is Lactobacillus rhamnosus and Bifidobacterium lactii as a capsule. So the aims of the study were to determine whether a dietary intervention with or without probiotics can actually reduce excessive gestational weight gain, as like Silipa was saying before, greater than 0.27 kilogram per week, and also optimize the infant birth weight. It's a 2x2 factorial randomized controlled trial in pregnant women BMI over 30 at 12 to 17 weeks gestation with a singleton pregnancy, stratified by BMI to a dietary intervention or routine advice, and then again to probiotics or placebo, and that's our exclusion criteria. So we needed 220 women to detect a 25% reduction in excessive gestational weight gain and a 225-gram difference in mean birth weight. So Dietary has already covered this, fortunately, about our community health workers training, because we developed a HUMBA handbook in here that the women had, and in it she had cover all the 4 intervention visits, and at the end of it, there's also quite a lot of ways to be more physically active, and quite a lot of recipes that we got from the National Heart Foundation. So it's all included there as part of the intervention. So they got text messages and also got their probiotics or placebo. So the women in the routine advice received the best practice Ministry of Health pamphlets on eating for healthy pregnant women and healthy weight gain in pregnancy, had capsules. Or the women in the dietary intervention also got text messages, and some of them we just developed them ourselves, and like the baby talking to the mum, your protein is the size of the palm and not the size of your arm. So, and we had to develop those because there was nothing in the literature, and they didn't, So that group didn't get any text messages and no community health worker visits, but they got their capsules, either placebo or probiotics. So that's our study processes. They were seen at recruitment, 28 weeks, 36 weeks at birth, and there's Chris McKinley's here, and he's doing all the follow-up studies to 1 year of age for the children. So we started in April 2015 to June 2017 last year, and our last birth was January this year. So out of 482 referred, 230 were consented and randomized to dietary intervention 116 and routine advice, and then probiotics or placebo. And we were really blessed that we had 90% of our primary outcomes. As you can see, the demographics across the groups were very, very similar. Like 60% of them, over 60% in the highest deprivation quintile, and 2/3 of them are New Zealand born. There was no difference across groups in the ethnic distribution. So the randomization worked, in other words. So the primary outcomes, the proportions with excessive gestational weight gain, there was no difference between the groups in terms of excessive gestational weight gain as per IOM guidelines. What about birth weight? There was no difference in between the groups in birth weight of the babies. There was no difference across the groups in terms of some of our very important obstetric outcomes, as you can see there: preeclampsia, C-sections, preterm birth, large and small for gestational age. There was no difference in rates of gestational diabetes across groups by the international criteria and the New Zealand criteria. If we use the international criteria, you'll be 3 times more likely to be diagnosed with GDM. However, fortunately, if you look at the dietary intervention, the total weight gain from the time of recruitment to 36 weeks, there was a 1.76 kilogram less total weight gain for the mums. So that was really encouraging. And there was no effect with the probiotics. So I won't cover that because Deirdre's already covered that, with the evaluation, overall satisfaction, the community health workers helping women to eat healthy. They would recommend it to a friend, and most of them read their text messages. So in conclusion, in this multi-ethnic sample of pregnant women with obesity, our nutritional interventions or probiotics did not have an effect on our primary outcomes. The rates of GDM and other secondary outcomes did not differ between groups. The women in dietary intervention had a 1.76 kilogram less total maternal weight gain from baseline to 36 weeks. Women enjoyed participation in the study, and it was feasible. It's a difficult study, it's an expensive study, it requires a lot of organization, but we were really glad that we did it, and we managed to do it. And we will wait for the long-term follow-ups of the mothers and the infants. Just want to acknowledge, my PhD supervisors. Leslie's here, Caroline Crowther, all the women who participated in HUMBA, our HUMBA study group. Some of them are here as well. And all the funders. We had some assistance from Counties Manukau, which was great, and in-kind support as well. And like I said, this kind of study requires a lot of work, a lot of collaboration, and we're really grateful. So thank you.